call the meeting to order. We'll start by standing for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Roll call, please, Angie.
Bush.
Here.
John.
Here.
Chambers.
Here.
Heisner.
Here.
Sullivan.
Here.
Lindsay.
He's muted, Doc.
Stefas.
Yes. Here. All right, we'll start with board communications. Anybody want to start with board communications?
I will.
Okay.
As we all, I believe, have received a boatload of emails about the attendance protocol for the sectional wrestling tournament coming up Saturday. I just want to thank everybody. I don't know if I responded to them all or not. I appreciate the input, and some of the most of the emails were well written and hopeful ideas what could happen, what we could do on Saturday. So I appreciate that. Even emails as far away as 2.5 hours. It's unbelievable.
Same stuff.
Similar, the wrestling emails, and then I also, and I'll bring it up when we get to that topic, but I did receive some feedback around the quarantine topic as well, but I'll incorporate that into my thoughts as we get to that point in the meeting.
Yeah, same, lots of wrestling emails, yeah. Lots of wrestling emails. I've had a few emails about the quarantine topic, but nothing extraordinary.
Doc Lindsay, any board communications?
I counted up 35 emails, so the summary is basically more about the wrestling than anything else, about allowing more participant by family. And then a few of the emails were about we should stick with the current guidelines. So that was the sum total of almost 40 emails.
Okay. I would say the same for me. We will jump into citizen communications. We have one person here that would like to speak, Cash Reichling. What's that? Corey, did you want to speak to something on this?
I can.
Did you?
Larry was just going to say that he's going to chime in with me if you needed to.
Well, if you wanted to sign up with citizen communications, if you want to speak during this point.
Okay.
Okay, you go after Cash then. Cash, go ahead.
All right. Am I supposed to stand at the podium or just sit and relax?
You can stand up so the people on the screen can see you and hear you.
Stand up. First time I came to this, so I just wrote my notes down. My name is Cash Reichling. We have 4 children. 2 of them are currently enrolled in the district. My family recently has had a dealing with our current COVID policy. To say I'm disgusted with the way the district handled the situation is an understatement. The fact that we are here for a special board meeting on the handling of these policies is an interpretation that the school board is not happy and looking for clarification as well. I know there are other families that feel the policy oversteps the boundaries of what is going on within their homes as well. On Thursday, January 14th, our 4-year-old Bentley, who is not enrolled in any school programs, threw up twice. His symptoms included vomiting twice. My wife, who is by trade an LPN since 2007, 14 years experience, made the decision to stay home and monitor Bentley. She went ahead and sent Riley, our 7th grader, and Gunnar, our 4th grader, to school. Later that morning, our 4th grader went to the school nurse asking for some Tylenol because he injured his finger the day prior with a pressure washer. The nurse politely explained to him that she needed permission to administer Tylenol and she could not just give it to him. Gunnar said, "Call my mom. She is home with my brother. He is sick." There was then a phone call made from the nurse to my wife. The conversation went straight to COVID. There was no mention of Gunnar's complaint of his finger, pain, or Gunnar's request for Tylenol. It was an agenda-driven conversation. Conversation included a list of COVID-related questions. Has he been around anyone with COVID? Does the patient have a temperature? Does he have a loss of taste or smell? Does he have diarrhea? It was explained again, none of these symptoms were present. He vomited twice. And if we thought that they were in contact with someone who had COVID, we would not have sent the older children to school. My children were withheld from an education because the school nurse thought they were exposed to somebody with COVID based on judgment. This is where there's a hole in COVID policy. Would you expect that a family kept school-aged children from home if their 1-year-old sibling was cutting teeth, just running a fever? Should my wife had said he drank bad milk? Because this is where things are headed. Open communication is a big deal. Keeping people honest is what your people need to be doing. One more thing I will let you reflect on. I thought this was a special meeting for the COVID policy. I noticed last night at 6:16 p.m., you chose to add sectional wrestling to the agenda as well. I'm so proud of our wrestlers. Kids need sports. But how can you really be worried about COVID and being 6 feet apart and contact tracing if you want to make the adjustments to allow spectators into the events? I think it's great. You should let them in. Make the adjustments to your COVID policy to keep the kids in school as well. It's time to look in the mirror and ask yourselves, what side of the fence are you really on? If there's a person in the room that thinks by limiting attendance to the sporting events to limit the spread of COVID, they're naive. As we all know firsthand, the faculty, the staff, the students, and the general public are not social distancing. It's everywhere else in the community. Enjoy the evening, folks. Now give the students of Winter Point School District the education and sporting events they deserve. Thank you.
Thank you, Cash. Thanks, Cash. Corey.
Stand right here, Nate. My name is Corey Sokol. I reside at 714 Doty Street, Winter Point, Wisconsin. I've been coaching wrestling for 6 years. I've been coaching the high school golf team for 11. And, first off, I want to thank the board and the administrators. It's a pretty thankless job. I understand that. I know I talked to Mitch about trying to get involved with this deal as well. So I kind of know that there's, especially this year, hard decisions to be made that you don't know if they're right or wrong. The thing that I'm just going to try to talk about tonight is sectional wrestling. I think the fan stuff this year, it falls into that category as well. What's right or what's wrong. After seeing what we seen last week, Saturday in Lancaster, I know there's COVID police out there. Everybody's got to take a picture. Everybody's got to post it. Everybody's got to do that stuff. I thought our fans did very well, especially when I think we got to set an example for the next week. We want to be allowed to have this happen. Talking with the kids tonight, I know that they're on board with it as well. And I just think it's been a really tough year on these kids to not have their parents involved with their accomplishments. And, I'm not saying this just to sugarcoat it and make it sound well, but there are people coming from a long ways away, all right? And I just recently became a father as well. And you start to really feel that appreciation of what you have for your kids, your love, and you would do absolutely anything for them if they were to get hurt. So now these parents have a chance to be 2.5 hours away in one of the most contact sports next to football, to where someone could have an injury and result in going to the hospital. And I just would like to say, what would be going through your mind for that 2.5 hours if your kid was knocked unconscious? If you're coming from La Crosse or north of that. So there are different things that need to be thought of with this. Now, is there guidelines that are put out there? Yes, totally agree with that. Do we need to abide by them? Yes. I guess we got to do what they're trying to say to stop this spread. I understand that. But at the same token, I do think that it's doable in the gymnasium of our size. I've talked with Gary on a lot of these issues and Larry, and I just think that there are definitely ways, that Mineral Point can figure this out. I think that one of the things that we pride ourselves on here is that we're supposed to be a leader, especially in this part of the state. I always see us posting all of our accolades everywhere. And I think that that's where, in these times of COVID, the leaders need to step forward and start taking charge a little bit. And, I think that this is just a small opportunity for us to do that. And you always hear that word normal. I'm getting so sick of hearing the word normal right now. And I think everybody in here can probably agree with that. But I think we need to start taking some steps and getting our lives back to that. All right. I'm going to just leave you with one thing here, and it's just a personal deal with me, is with being a wrestler, making it to state is probably your first ultimate goal. And when you do that, you want to share that goal with your family members. I was not fortunate enough to do that with my father, because he passed away before that. And I can tell you right now, with being on that coaching side, that is one of the more gratifying things. You can see the kids be able to experience that deal with their parents. So that's all I wanted to say, and thank you.
Thanks, Cory.
You didn't sign up, but did you want to? Okay. Is there any audience with their hands raised that would like to speak? Alex Carey, go ahead.
All right, give me 1 second here. Sorry, I don't know how to get rid of my screen. Okay. Well, first of all, this meeting has me frustrated, and I just need everybody to remember that there are, unfortunately, multiple sides to this issue. Those of you that are speaking for the change in policy, I understand you have your reasons, but remember that there are a lot of us that feel the opposite and don't want to see the risks change. From my perspective, I just want to remind everybody that the central goal of our safety measures are to keep the kids in school, all of our kids in school, and that the adjustments should be made if and only if we're being advised by health officials to do so, not by students, not by staff, not by parents that feel it would be beneficial. If you're going to publicly throw our nurse under the bus, I'm going to publicly remind everyone how incredible of a job she is doing and has done during a time with little guidance on how to navigate. She is doing what she is told to do, and she's doing it well. I fear if anyone else has been in her shoes, where we'd be today. If your child had a symptom of COVID, if your child has thrown up one time, that needs to be addressed. That is what we are supposed to be doing. Most people don't know where we pick up COVID. If we all ignored our symptoms, this would be a lot worse. Our nurse is amazing. And yes, she's a friend of mine, so I'm going to back her until the day we die. But she's doing a good job, and we need to respect that. Now is not the time to play odds. And there are no fences here. We're all on the same side. We just all have that same issue to deal with. We have to have the intelligence to make these changes because COVID's not over. The grounds for change cannot be from COVID fatigue. Please keep that in mind.
Thank you, Alex.
Thank you.
Any more citizen communications?
I would like to say something. Al, can you hear me?
Yes, please introduce yourself.
This is Christy Springer, Nolan's mom, and this is on the situation about wrestling. And and I'll probably end up starting to cry, so I apologize now. A bunch of us parents have been talking, and we would like to know, is there anything in particular that the board or the school district would want us to do in order to be able, as parents, to come and watch our children wrestle? I know that, this whole COVID thing, I get all that, but I also have an issue that we have not been able to watch our children wrestle we had 2 home duels. One of them was senior night, and we had to ask the school district and the board if we could go see our children wrestle. But basketball, for all their games, they get 2 games a week, plus some of them did play on the weekends. And in our school, parents were able to go for that. And our duels, there's only 2 schools. Also, for our sectionals, there's 22 schools, a total of 112 kids. There's 38 seniors, 30 juniors, 20, I think it's 3 sophomores, and 18 freshmen. So we were, as parents, trying to figure out if it was possible that we could have sectionals to where spectators can come. So whether or not we have 2 sessions, the first 7 weight classes go, I'm just going to say in the morning time, and then the next 7 go in the afternoon, or have it to where seniors get 2 tickets and the other classes get 1 ticket, just as long as the kids have somebody there watching them, because I know the other classes, and I don't know, maybe to them this will be the only year that they do get to sectionals, but they still have more chances to. We have seniors that are going to be at sectionals that unfortunately may be their last time that they wrestle, and they're not going to have a parent there. And if that happens to me, I'm going to be devastated, just like it happened with football. So I am asking and I am begging the school district and the school board to please let us parents come and watch our kids. And you tell us what you want us to do. All of us parents for the other schools are willing to help. We're willing to do whatever it takes. Lancaster, we all had our masks on, and I was watching everybody comply to everything that was asked of us. So I am begging you to please let us watch our boys. Thank you.
Thank you, Christy.
I changed my mind. Jenny B, I do have just a couple points I would like to make since I'm here.
Come up here so make sure the
Yep.
camera can pick you up and the microphone, please.
Just briefly, on the first measure with the quarantine guidelines, I just want to say I came to the meeting, it was September or October, and all the resistance I was met with was the CDC says, the CDC says, the CDC says. Well, now all of a sudden the CDC says something different. And now all of a sudden we know better than the CDC, and I guess I feel the hypocrisy there. And I feel like if we're going to go with something and we're going to use that for reasoning, then we need to carry that through. The second point about the sectional wrestling, I come from a wrestling family too. I don't have any skin in the game. I don't have any kids wrestling or anything, but it's a magical day. And you're taking a lot away from these kids and these families. And not only that, but if we're so concerned, then why did we allow our athletes to go to a gym full of spectators last week? I leave you with that.
Thank you, Jenny. Any more citizen communications?
I don't see any.
Okay. Good. All right. We're going to go into items for information discussion. The Mineral Point School's current quarantine protocol, the Q&A session for the board. So this came to be about because there's been a lot of confusion, I think, with the community, maybe partially the staff and the board as far as what our protocol is. And actually it was stated earlier by a citizen that Jane Lindsay has been kind of run down by people, and that is unacceptable. Jane has done everything that the board has asked her to do and told her to do, or from the board and the administration. So if you want to call somebody and complain and harass and talk behind their back, look up my number. It's online. I don't care. Okay, give me an earful. Jane's doing everything she's been told to do. So I will leave it at that. And if there's any other questions on the current protocol for Mitch right now, or for Jane, Jane, are you on?
Yes, I'm on.
Okay, and Dr. Fox.
And Dr. Fox is on for questions as well as the current protocol for questions.
Can I ask a question?
Absolutely, go ahead. Norma.
Could we have clarification, not just for the members of the board, but also for the audience, around how contact tracing is working, particularly in the school environment where kids are changing classes? So I understand the elementary school where the cohorts are really in place, but in the high school, how we know which students have been within 6 feet for more than 15 minutes throughout the day. Would you talk us through that, Jane, just so we have a good understanding of how that works?
Yep, I speak with the student and parents first to get an idea of anyone they can think of who they would have spent extended time periods with or several shorter time periods with that would add up to 15 minutes where they would have been 6 feet or closer during that time. And then once I get that information, I go to the classroom. I have Matt Austin comes with me if I'm doing high school, and we measure out, we use the seating charts, we talk with the teachers, and we use the seating charts and we measure out 6 feet.
So it is possible that if I sit in the front of the room and a classmate who sits in the back of the room and is tested positive, that I am not a close contact. Is that correct?
If you're outside the 6 foot radius, yes.
Thank you. I think that was a misconception that I had heard, and I wanted to make sure I understood correctly. So I appreciate the clarification.
Do we have any other questions for Jane on this topic since she's right here?
I do get a question on the Reichling situation. When you have a parent, Jane, that tells you that the child at home has an upset stomach, are you required not to believe them, or you just choose not to believe them? Jane, I'm just curious. And send the other kids home from the school.
I guess I'm not sure what you're asking.
Well, the mother of the young lad at home specifically told you there was no symptoms of COVID, and they weren't around anybody that tested positive that they were aware of. But you still sent the students home that were in school. I have somewhat of a problem with that. And we hear about trust around here. I know Vicky's mentioned it a couple of times at the very last meeting. She was confused about trust with parents. And you choose not to trust a parent with a medical background.
Larry, can I clarify that?
No, I'm talking to Jean. Please let her answer. Please.
In a very firm way, Larry. So watch what you're accusing her of doing. Ask a question if you want.
I thought I did ask a question.
Jane, do you want to answer that?
I will be careful on how I answer it because of HIPAA. But I do my best to do a nursing assessment with the information that folks are willing to share. Sometimes people are willing to share and some people are not. And I use my nursing judgment and I follow my protocols.
As a spokesman for the board, I'm embarrassed that this school acted the way they did with that particular family.
I'm afraid that there's going to be two sides to every story, and I don't want to share too much because of HIPAA, but I assure you I followed my protocol.
So let me ask then Mitch the question. If a parent says, I think my child ate something and has an upset stomach, will you, if a parent calls in and says, I don't think it's COVID related, will you call Jane in have her send the other kids home in the school if there are any?
Do I? No.
If-
Go ahead, go ahead, Jane.
If we have a reasonable alternative cause for a symptom that is confirmed, like you said, your example of eating something bad or like that would be a good reason to believe there's an alternative diagnosis. But for example, if someone were to say, well, they have the stomach flu, that's not something that I can verify without a test, especially if there's no other cause for a specific symptom that we can identify. That's where it gets a little tricky, and every situation is different, and I'm sure to ask several questions to make sure that I'm making a good choice and following my protocol.
I understand. Thank you, Jane. And that situation was one that prompted the special meeting.
Jane, when you talk about protocol, are you still looking at I'm going to describe this, hopefully everybody will know what I'm talking about, but the two lists of symptoms where there's like the one of these symptoms and you're out, and the other list of symptoms is two or more of these and you're out, or is there some other set of?
Yep,
Okay.
That's the same one that we've had since school started.
And just to be clear, Jane, that applies to everybody in the household.
Yeah, I mean, I'm sure that I'm not getting called every time anybody's sick, but yes, if I have reason to believe that, someone at home has symptoms that potentially could be related to COVID, I would want the kids to stay home.
I guess my only question is, anybody can answer this. Is the school able to make someone test before they return to school? By law, can we force somebody to test to return to school?
No.
No. Okay.
But we can exclude them for 14 days should they choose not to test. Is that correct? That would be our.
Yeah, there may be situations, this is Dr. Fox, there may be situations where the option is given, if you have a test and it comes back negative, you can return on such and such date. If you choose not to test and you're having these symptoms that are suspicious and we have no alternative diagnosis, then you may have to exclude for that entire period and assume a positive there. But that's not for everybody. That's not everybody is excluded for 14 days for a runny nose and a cough. It's really the situation of, when did the symptoms start? What kind of exposures have you had? What else is going on in the household? So Jane spends a lot of time talking with families about what's actually going on, and then looking at the policy and seeing, do they meet criteria to return now without a test, or do they need a test to come back, or do they need a quarantine to come back if they don't have a test?
Nate? Yeah. Can I ask a question?
Yeah.
Dr. Fox, Larry Steffes. The large group of kids that were sent home a week and a half, 2 weeks ago, they do not or did not get the ability to test and return before the 14 days. Am I correct in saying that?
That's correct. And if people are interested, I do have a few slides prepared about the CDC recommendations and DHS recommendations to talk through, if that would be helpful for people.
I would find that
Yes,
beneficial.
I would too. I've spent a lot of time looking this up, so I'd be interested to see what you have to offer, Sarah.
Okay, I'm going to try to share my screen. If I don't have permission, somebody might need to. Hold on 1 second before I do that.
I would also like to editorialize a little bit. We now have in the state 2 new COVID varieties, and we don't know the replication rate of those. So some of these guidelines that are shifting a little bit, which I don't think they should, haven't taken into account the new strains that are appearing. So I'll be eager to see these slides.
Yeah, so I do mention that at the end of the presentation of things that are kind of unknowns that might affect this going forward. But just to start, the definition of a close contact, you're a close contact if you meet any of the following criteria after contact with a person while they're infected with COVID-19, even if they did not have symptoms, even if you were wearing a mask. So the infected period goes back to 2 days prior to the onset of symptoms, or if the person is asymptomatic, goes back to 2 days prior to the positive test. So if you were within 6 feet of someone who had COVID, you had direct physical contact with the person, you shared eating or drinking utensils, or they sneezed, coughed, or somehow got respiratory droplets on you. So that's the definition of close contact. That has not changed at all. That's been the same from the beginning. The things that affect contact tracing, the amount of time someone has spent with a person who's positive, the amount of distance between the people, whether there was any physical contact, when the contact occurred with relation to symptoms or positive test, and whether the person exposed has recently had confirmed COVID. So there is a definition where within the 90 days after someone has had COVID, if they get exposed again to someone who has COVID, they are not considered a close contact that needs to isolate. They should still monitor for symptoms, but the likelihood of them contracting COVID during that time is small enough that they are not considered somebody who needs to be excluded from school and things like that. Things that do not affect contact tracing, whether people wore masks, whether they were indoors or outdoors, whether there was a plexiglass shield, whether the person was asymptomatic during the time of contact, or whether the people either person had negative tests previously. So if somebody, had a negative test on Monday and they were in contact with people on Monday and then had a positive test on Wednesday, those people on Monday are still considered close contacts. So the CDC has made some modifications for quarantine guidance because of the burden of quarantine on people who are trying to support their families with working and things like that, and for people who might have lower risk of exposing other people while they're at work. So this is the actual guidance from the CDC website on their modified quarantine. So I highlighted that it says reducing the length of quarantine may make it easier for people to quarantine by reducing the time they cannot work. It doesn't talk about other activities outside of work as being a reason for the shortened quarantine. Options to consider in stopping quarantine would be after day 10 without testing, or after day 7 after receiving a negative test result. The test must occur within 48 hours of stopping quarantine, so that's on day 5 or later. After stopping quarantine, you would have to watch for symptoms until 14 days after exposure. If you have symptoms, immediately self-isolate and contact your local public health authority, and wear a mask, stay at least 6 feet from others, wash your hands, avoid crowds, and take other steps to prevent the spread of COVID-19. So of note, CDC continues to endorse quarantine for 14 days, recognizes that any quarantine shorter than 14 days balances reduced burden against a small possibility of spreading the virus. So the important piece here is the wear a mask, stay at least 6 feet from others, wash your hands, avoid crowds, and take other steps to prevent the spread of COVID-19. If you are somebody who, say, is a truck driver, or somebody who is working on a farm and is able to distance from other people, that would make a lot of sense to have that early return from quarantine, because you can distance from people, you can monitor for symptoms. If you are somebody who is in school and sports, the likelihood that we're going to be able to find a scenario where somebody is not going to be within 6 feet of other people for the entire day, not going to be eating with other people without a mask on, and certainly not able to participate in sports or any contact activity during that time, it's not something that would fit within the quarantine guidelines to have those people return to school on a shortened quarantine period. So that's where the CDC is. DHS, which is the Wisconsin Department of Health Services, is very similar. Quarantine may be shortened from 14 days to 10 days after last close contact, provided people still monitor for symptoms, wear a mask, physical distance, avoid social gatherings for the full 14 days. And then again, at the bottom, these alternative strategies are considered acceptable, but not preferred, because they carry increased risk of transmission compared to the 14-day quarantine. So CDC we do not fit within CDC guidance for early quarantine release for kids who are in school or kids who are in sports or teachers, for the most part, who are in school, unless they were in some isolated classroom or something like that where they had no contact with other people. And Iowa County Health Department has gone with this DHS recommendation as well, where they do not believe that schools are a site where early release from quarantine is appropriate. So CDC, DHS, and Iowa County Health Department all are in agreement with this, that this does not apply to a school situation. This is a busy slide. It basically looks at what the risk of post-quarantine transmission would be. The lighter purple bars are quarantine if somebody has no symptoms at all, and they're just quarantined, versus quarantined and no symptoms and a negative test, and how likely it is to still have ability to pass on illness at certain time periods, or have infection that they could pass along to other people. This part down here gets kind of blown up into this part up here so that you can see the percentages a little bit better, because, down here it's all the way up at 60%, versus down here it's, down below 10%. However, if you look at each of these graphs, this error bar goes way up here. So the error bar being that high means it could be greater than 10% for each one of these situations, down to possibly 8% at 11 days, 6% at 12 days. So if we brought back a group of kids that had been exposed for 10 days with no testing, there would be up to a 20% risk on day 10, and down to only maybe 8% risk on day 11, 6% day 12 for passing on that illness. So that really is not an acceptable risk when you're dealing with a school situation where somebody might come in contact with 50 or more people in a day, or at least 25 in a day in the high school situation right now. When you add in the testing, it does improve the situation a little bit, but it doesn't take it down to zero until you get to that 14-day mark. And so really even a very small risk of infection being passed along within a school setting can become an outbreak very quickly because of the number of people that are involved and the inability to social distance. So that's why they have continued to recommend that in a school setting, in any kind of setting where people are gathering and coming in contact with each other, that a shortened quarantine not be adopted. This is kind of the reason for this kind of guidance is part of this. It's called the Swiss cheese model of protection. So if each one of our layers of protection was perfect, then all we would have to do is wear masks and we would be fine. If masks were perfect, masks aren't perfect, testing isn't perfect, symptom reporting isn't perfect, not everybody has symptoms, the amount of exposure, the distance between people, none of these things as measures of protection are perfect. So we need multiple layers in place in order to make this be something that doesn't lead to spread within the community. So when we look at the layers of protection or physical distancing, if crowded, limit your time, ventilation, quarantine and isolation, all these things need to be put in place. And if we start pulling out, so we have people within 6 feet at the school, so we no longer have this layer of protection. If people are not staying home when they're sick, we no longer have this layer of protection. It just makes it that much more likely that we'll have spread within the school and outbreaks that we're not able to control. So this is recommendations from the CDC, and I'm almost wrapped up here, and I'm happy to take some questions. So this is the recommendations for the CDC for how to return to school safely. And so if you have very few cases in the community, you have a very low % positive rate, and you're able to implement all 5 of these strategies to mitigate spread within the school, including social distancing as much as possible and contact tracing, then you have a very low risk of transmission within the school. Even if you're doing these things perfectly, but you have high rates in the community, you're going to have more spread within the school, just because that spread is going to filter down because we don't have those perfect layers, we have Swiss cheese. So if we are able to, have very low transmission in the community, then we could probably get by with doing 3 to 4 of these strategies pretty well and not have much spread within the school. But if we have, even this low to moderate range, we are going to have spread within the school if we're not being very, very careful with all these strategies. I do have a couple of graphs of where we're at right now in the community, if that's helpful for people. So we saw our big spike in November. This is Iowa County, very similar to the Wisconsin curve. We did have a peak after Thanksgiving, and then saw a kind of tapering off after Christmas. So things didn't rise back up, but they didn't fall quite as quickly as they had been falling. And now our levels are back to where they were in late September, which is really, really good. I couldn't go back further than beginning of October, but this is Iowa County here in a very high level of activity. This is the earliest map I could get back to. We had 663 cases per 100,000, and I'm just going to flip through. This is every 2 weeks. So this is by beginning of November, we were at 1,000 per 100,000, which means like 1 in 100 people had cases during those 2 weeks. 1,800 per 100,000, and the whole state was red. That was middle of November. And if we keep flipping through, we can see things have calmed down everywhere, and Iowa County is actually doing pretty good compared to surrounding counties. And then, we can see that everybody has kind of improved here. So that's really good. We have decreasing cases in the community. We, hopefully will continue to see this decrease. The problem is we now, as Dr. Lindsay discussed, we have these emerging new variants that we don't know how much differently they will spread. They will likely become the dominant variants in the next month in the entire United States, and especially in the Midwest. We also have colleges back in person, and we know that this fall when colleges went in person, we had they fed an outbreak in the state in Wisconsin, in all of the cities where the UW schools are. That was the beginning outbreak for those counties, and so that then spread out to the rest of the state, which is why we saw so much red in the state in November. However, on the good side, we also have a lower burden of disease currently in the community. We have vaccinations getting rolled out slowly but surely, and we have warmer weather ahead. So those things might act in our favor, but we really don't know how these things are going to mix and how we're going to see this develop for the next couple of months. And so I think now is certainly not the time to change any of our guidance or loosen any of our protections that have helped our community stay healthier during all of this. So those are the main points I wanted to make. And if anybody has questions, I'd be happy to answer them. And I know it's a lot of information, so sorry to bombard you with all of that.
I've got a quick question for Jane. Jane, you there? Hey,
Yes.
How many, out of all the close contacts that we've had, how many have tested positive while out on quarantine? Do you have that figure?
I don't. I can look. Let's see.
I guess would you even be able to look it up? Do you keep track of that?
I can. I don't have that right this moment, but I sure can. But I just want to point out that that's such a variable because there's not that many people testing. Well, if we tested every single close contact, again, that's a snapshot in time of when they were tested. So even if everyone did test, you'd almost need serial testing to really know. You'd have to do it all the way through the 14th day to know if they ever really contracted it. And with so many people who are asymptomatic, I don't know that we'll ever know for sure. But we do have evidence of spread in school, if that's, where that is going.
I guess, yeah. I was just kind of curious as to, if 50 kids are out because of close contact, if they all come back 14 days later and all of a sudden one of them is out as soon as they get back, and tested positive. I guess I was just kind of looking if there was a number in there somewhere. I was just curious, just where my mind was.
Sure. Sure.
I've got a question as well, Jane, and maybe a clarification and maybe just a concern about some wording is one of the documents we've shared from the CDC says to be at least 6 feet away. And one of the documents says within, and to me within means inside of, but it sounds like we are using 6 feet as a close contact. And it just seems like that's potentially counter to what we have posted. So I just want to clarify so everybody is on the same page of what that mark is.
So the way that all the school nurses that I'm in contact with and the Iowa County Health Department is it's at 6 feet and within would be a close contact. And again, we're measuring back of the chair to back of the chair. So that's a pinpoint spot to another pinpoint spot, but we have body on either side of that pinpoint spot. So in reality, people are within 6 feet. If I'm measuring pinpoint back of the chair to pinpoint back of the chair, our bodies then bring us to that within 6 feet.
Thank you.
I've got a question for somebody. Again, we're going back to the CDC guidelines. Wouldn't you think it would be important for the CDC to identify schools? In the disclaimer at the bottom, they have long-term care facilities, shelters, jails, prisons. What you're trying to tell me, I'm not buying it. I think schools have become comfortable with the 14-day quarantine. Mitch sent out an email last week. He did a study, and other schools in our SWAT conference, I guess, are doing the 14 days. If the 14 days was so important to the CDC, it would be identified on these guidelines.
You know, I think it's,
explain it to me.
yeah, I think the problem is, you know, there are situations where there might be schools that could comply with this. So, for example, St. Joe's, it's very possible that they could space people out to the point that they're not within 6 feet for the entire time they're at school. So I think the CDC has, you know, been very clear about these are the things you need to follow for the 14 days without prescribing that's, you know, within a workplace or within, you know, you're an office building or things like that. They have specifically had, we had a, healthcare workers have an exception for this rule if they're getting frequent testing. So we have an exception for this rule for the hospital if we do daily testing on people and are doing surveillance. And we had to get approval of that plan through Iowa County Health Department and the Department of Health Services in order to implement that. So each school would have to, if they're going to go outside of what the recommendation is, would have to get individual approval for that. And I could see that you could have possibly some isolated schools that would be able to have that 6 feet of distancing. And it might even be a school that's hybrid, or maybe you have, you know, the alternative school might be a spot where you could potentially have kids in a distanced way. But for the, you know, so it's hard to make a recommendation for an entire school building, every school building, not knowing what everybody's situation is. So I think there's a lot of private schools, honestly, that are able to do a lot of things that we're just not able to do because we don't have the space. We don't have maybe the money. We have the number of kids that we have. We can't control that. St. Joe's was able to limit the number of kids that they enrolled this year so that they could distance people differently. So we just are not in that situation. I think unless it was on a very, very case-by-case basis, I don't see how you could change this policy to shorten quarantine. And certainly if people are shortening quarantine, that would not be something where they'd go back to sports. And it you know, it feels like a lot of the time the pressure is to really try to get people back to their activities a little faster, and this would not do that. So even if we had a case by case, we could bring a kid in for a test on a day because they can sit 6 feet away and they're, you know, they've had a negative test, things like that. It wouldn't bring them back for gymnastics or anything like that, or wrestling or any of those sports.
I would just add that, I would like to add that the CDC actually does have a site that talks about 14 days as far as kids being quarantined from school. It actually does list it.
Dr. Fox?
Yeah.
You referenced, in your slideshow there, and I was unsure what you were getting at. You're referencing truck drivers and farmers. Were you saying that if a kid was a truck driver or farmer, they could come back in school?
Nope, it was really to say that those are the types of workplaces that would be ideal for somebody to have a shortened quarantine, because they may be able to socially distance at a level that somebody who sits at an office building with a desk right next to it would not be able to socially distance. So they really recognize that some people, we need to get people back to work, and this was burdensome to them to miss work for this amount of time. So in those situations where they're in a job that is socially distanced, they could get back to work sooner than that 14 days if they follow this shortened quarantine. But so those were just two examples of ones where it'd be more easy to socially distance than like a teacher in a classroom, for example.
If we stay on the same path, the county numbers, I Mitch said we were at a 5. Over the weekend. When do you expect schools in general to relax these guidelines then, Dr. Fox?
Yeah, it's a good question. I think one consideration is when all of the higher risk people in the school building would be able to be vaccinated. So, teachers are hopefully next in line based on what Jane sent out today. It's March 1 at the earliest. So that would be the earliest that we'd start getting teachers vaccinated. And we're looking at 6 weeks after that before they'd be fully have full immune response to those 2 vaccines. So, we're at least looking mid-spring before that situation is in place. But really, we have to see sustained improvement in our numbers. And it is looking very promising. And I'm hopeful that these numbers stay the same way they are. But the big question mark right now is these new variants and how that's going to affect things if they become the dominant strains, because they spread much more easily. And so the same things that we've been doing that have worked really well may not be as effective once these strains are the dominant strains, because they may spread more easily. So we may see different holes in our Swiss cheese that we then have to kind of figure out how we're going to mitigate.
Is there any information about the current vaccines and their effectiveness on these variants?
So far, it's looking promising. So the variants that we have right now, there are 3 dominant ones that we're kind of following closely. One is the UK one, one is one from Brazil, and one is one from South Africa. And so far, the Moderna and Pfizer vaccines seem to be effective for all 3 of those variants. There may be a little reduced efficacy for the Moderna and Pfizer, but really pretty good. So still probably 90+%. However, one of the newer vaccines that is coming out is the Johnson & Johnson one that was looking really promising and would be much more easy to implement kind of on a wide scale. And unfortunately, against the South Africa one, it does not look like it's going to be effective. So, if we are able to suppress that strain by doing really aggressive contact tracing and, reducing community spread and not seeing that spread, much further than where it is right now, which it's probably in many counties in the country without us knowing it. But if we can track that down and suppress it, then it's not going to spread anymore, and we can get people vaccinated and fight that off. So the variant strains don't spread by themselves. They spread by infecting another person and then infecting another person. And so if we can stop that, we can cut that off by doing all the contact tracing and reduction in spread that we're trying to do on the community level. We will hopefully then be able to get people vaccinated and actually see some good long-lasting protection from this. Brazil, their strain, unfortunately, they had huge waves of illness over the summer and fall, and they were hoping that they were at herd immunity because they had probably 70% infection rates in some places, and many of those people are now getting reinfected with the second strain. So it does seem like it's something that's evading the immune response that we were hoping for with herd immunity. So really important to suppress all the spread right now and then get everybody vaccinated, and hopefully we'll be able to get back to some semblance of normal and see more kids in the classroom without seeing this community spread.
Doctor, I just want to know what Dr. Dunn's thoughts were on the quarantine, et cetera.
What's that?
Just another professional voice that we have on our disposal. We might as well.
Well, I basically agree with everything that Dr. Fox and Jane had said. I think the key with these different quarantine options that the CDC presented, it does allow some flexibility, but also allows for confusion, right? And when is it right to do a 7-day, 10-day, 14-day, et cetera? But the CDC has been consistent in saying the 14-day is the safest option. It's not like the 14-day and the 10-day or 7-day are equally safe. Okay? So I think that we need to be clear on that. And so unless we have a really good reason to be less safe in our schools, then I don't see why we shouldn't choose the safest option. I think the other thing is that, I think what happened in the situation that Mr. Reichling had explained, that was an unfortunate situation. That is basically the problem of the complexity of COVID symptoms. Meeting head on with someone we've hired from the front lines to keep our schools safe from any COVID so that we don't go back to 100% virtual in any building, right? So we have hired this school nurse to be on the front line and say, you follow these protocols to the letter, okay? Which means anything that's listed as a COVID symptom is presumed COVID until we have an alternative diagnosis, right? Or a negative test, right? And vomiting is a COVID symptom, and so I don't know any more details about the situation than that either, but that is how I would have addressed it if someone called my office and said, my kid's vomiting, I don't know why, what do I do? That's how I would have counseled in a similar way. We need to look for an alternative diagnosis, but it is a COVID symptom and we have to presume as such until otherwise. And that's been the public health recommendation for addressing these symptoms as far as it goes. I can't tell you how many people who called me and said, oh, I've got the sniffles, it's my allergies. I know it, positive test, right? I've got this little tickle, I'm sure it's my asthma, positive test, right? So it's, that's the frustrating thing about this whole disease. And it inconveniences people, and myself included. So, and this is the unfortunate thing about having someone trying to enforce a very complex and interpret a very complex situation with quarantines that can be inconvenient. And, this is the price we have to pay to allow kids back in the classroom. We got kids here 4 days a week, and I supported that, and I still support it. But, we're going to have sporadic cases. We're going to have close contacts. We're going to have people in quarantine. And that's what we have in place to keep our school going. And so I think we're doing a very good job of managing the situation that's been presented to us. And I'm happy that we're all still in school, and I hope we continue that.
I'd like to jump in. I was called by Nate about the quarantine time period. It was a very good call. And I seriously entertained whether we should have a shorter quarantine. And I've spent a lot of time reading as much as I can get my hands on, but there's no doubt that we cannot shorten the quarantine. In fact, we may be facing a bigger problem with these new variant strains. in regards to what's happened here about the quarantine, I agree completely with everything that's been said, that we have this list of symptoms and Jane is there to enforce it. And that's the rules. I mean, I don't see any reason to change. I seriously considered it. I really did. There's been a lot of misinformation, which disturbing to me. But when I studied it very thoroughly, we cannot change this quarantine. I would vote against it completely. End of statement.
The WIA is a 14-day quarantine with the upcoming tournament season. They're 14 days.
So
I would like to add that I would like to find some way for more of the parents of the wrestling group to be there. You know, if we have to stick stickers that they sit so many feet apart or whatever, I would like to see more parents.
We'll talk about that next, Doc.
Okay.
So I sit here and I listen to these comments both as a board member but also as a parent, and I feel the frustration. What the Right Wings went through was not a good experience. We've had another email about a parent who was very frustrated about a child having to miss out on participating in some key basketball games because she was deemed a close contact. And I feel for them, but I can't think of any other questions to ask here. And everything I've asked has felt like it was answered reasonably and logically and supported by the documentation. I can't see any evidence that, for me, is suggesting that we should do something different than we are now. And you're welcome to disagree, but I'm sharing that that's where I'm at this point.
There was a report that I sent to Nate.
You sent it to me, yes.
It looked like it was a CDC sponsored report. The study of 17 K through 12 schools in rural Wisconsin. It must have been a regional report. During the 13 weeks of in-person learning, 0 of the 654 staff there was no issues. 7 of the 4,876 students did not get COVID at school. So we talk about the staff, and I understand the concern, but the numbers in the county are certainly falling. The vaccines are being rolled out. Some communities are more vaccinated than others. You know, we can stick our head in the sand here as long as we want, but at some point we got to keep these kids in school.
Larry, I got a comment on that study.
That's what the parents expect, Doc.
I got a comment on that. It's been on national news, and the guys that are smarter than me, the top docs, are saying the reason that study was so important was because those schools followed the rules. Greater than 6 feet apart, masking, and hand washing. They said that's the reason they had such a low incidence. That's been on the national news by several different news outlets, Fox, CNN, and MSNBC, because they followed the rules.
So in every one of them cases, the kids were no closer than 6 feet. There was no walking by one another in a hallway.
I'm just quoting what the TV said. They said they had the success because they implemented all those things.
We're supposed to put our faith and our trust into the school. The first semester with the famous hybrid plan that we were following was deemed a failure in my eyes, in my opinion. And now we're listening to the same people tell us that we got to stay with the same guidelines as the old guidelines, not the new one, the old guidelines. And at some point, we're going to have to face reality, and the CDC is telling us we can go to 10 days. There's nothing in here that says we cannot.
No. It says if the local district and the state, approves those guidelines, we can't just go as one school out of the whole state. I don't see how you could do that.
Well, this was what was laying on the table in front of me, and it says there's nothing in here, Doc, that says we need to stay at 14 days for schools.
But it does say that people who have that shortened quarantine have to follow certain guidelines. And I'll also say that part of the guidelines are, aside from distancing, which I don't know how we would distance everybody beyond 6 feet to meet these guidelines to have these people return a little bit sooner. And we're talking a couple of days sooner. But also it requires daily symptom monitoring and to be frank and honesty about symptom monitoring and reporting that we have not consistently seen among our student body since the beginning of this. So we have been frustrated by cases that have spread within the school where when we look back, the person should not have been in school because they had symptoms and then exposed other people. And so we're already seeing that potential. And sometimes it's hard. You just like Dr. Dunn said, you have a tickle, you don't know that it's COVID, so you don't report it. And then, 4 days later, it's gotten worse. You test positive. We have to go back 6 days to get back to contact tracing. And a lot of people have been exposed in the meantime. So unfortunately, we have not seen the level of commitment to excluding people from school themselves, saying I shouldn't go to school because I'm sick, or I think I should get tested because I was exposed, or my other kid was positive, I better tell the school about this. We're not necessarily seeing that implemented on a consistent enough level to be able to say that we would trust people to do self-monitoring for 14 days and report those symptoms. So I just have to be frank with that I'm not sure that I would be able to trust that kind of a system for early release from quarantine. But it is very clear in that CDC recommendation that people social distance and not have social outings. I don't know where people would eat lunch if they were to come back early from this, because we wouldn't want them to be in a room with another person while they're eating lunch. We don't have ventilation we can rely on in certain parts of the building. So we're really in a situation where if we're not following the guidelines of CDC, the Department of Health Services, Iowa County Health Department, the school is really putting itself in a situation where they would be accepting the risk and liability as a school board to go against the guidance of all of those public health departments that have made judgments about what's risky for schools and what's acceptable for those quarantines.
I believe you cannot hold a school liable for COVID-related issues. I got a question for Mr. Austin if he's with us. In the case of the parent last week thought that their child was outside the 6-foot post-contact area, and if what do you have in place, Matt, to assure the parent that the measurements are true and accurate, I guess? So if a parent has a complaint saying that my child's outside 6 feet, what are you going to do for that parent?
So really what I can do is I can explain that I can walk down to the room again and measure. Mm-hmm. I have a tape measure, I pull it out, we go 6 feet, mm-hmm. I have a seating chart, we measure that distance. We do talk to the teacher, we do measure that distance, we do check it, right? So if we're within that 6-foot circle, now understand it's not a 6-foot circle, it's a 12-foot circle, right? It's 6 feet on either side. Or deemed a close contact. So I can go back and I can remeasure it, I can explain it, I can't provide a seating chart with any kids' names on it other than their own, and I can kind of show them where that was if need be, but I mean, really, I'm asking that the parents trust me that I'm going to go and measure it faithfully.
Do you do the initial measurement?
Yep. I usually have, Jane obviously is with me when I do that. I've had other people look at it while I'm doing it as well. But again, I have a tape measure, In my office, it's orange.
And certainly you wouldn't allow a parent to come in to verify to witness it.
No, because I can't give identifiable information about where other kids are sitting in centers, right? So that's part of the hard part. I can't say, well, Susie was sitting there, so no, I can't say that, right? I have to measure from that desk, and myself, Jane, teachers, we're probably the only ones that should know where that is. Now, obviously, we're in a small town, it gets out there, but I can't tell you who tested positive. I can just go and measure, right? So I look at the seating chart and I go and I measure.
Can we just reinforce to the staff the importance of desks staying where they're at to the extent that we can?
Yep, and we have. And especially at this level, it's, hey, make sure if something does change, update your seating chart, get it to me. But, you know, that's something that we try to reinforce. But there are classes where, Jim, you're not in the desk, right? In Mr. Carey's class, you're not in the desk because you're up and you're working in the shop and you're doing this and that. And so we try to keep track of where people are, but.
More so the desks themselves.
Yep. And
I just had a couple complaints about desks being moved and then measurements being taken.
And then while I understand the thought and the theory behind that,
I'm
I can go in
just
there and do
saying
it that day, right? Yeah, I know what you're saying.
It's a bad look.
And I won't say that it's hard and fast, you're out, because I can think of another situation in the same week where they went to the seating chart, this student was within that 6-foot window. You are now excluded, you're close contact. Spoke to the teacher, and the teacher said, well, I'm sorry, on that day, we had something different going on in class, so I had some kids over here in the class, and this particular student actually sat in this seat, was remeasured. The student was not within the 6 feet, so the student was allowed to come back because they weren't in that close contact radius. So there are times that Jane will, I see emails that come through. Person A is excluded. 2 days later, person A is now allowed to come back to school, whether it's a remeasure and they were outside the 6 feet, they had a negative test, the person that they were exposed to that we thought was positive isn't positive. So, there are students that are not necessarily automatically sent to a 14-day quarantine period either. There are students that do come back early. To your point earlier, Larry, I think, and I would ask Jane to maybe follow up on this for me. I don't know that we've had as many students quarantined first semester in the hybrid that we've had this semester due to close contact and being within the 6 feet and so on. So we've had other issues. We've had staff members that were within that 6 feet and quarantined and couldn't find subs and forced us to go to virtual in the first semester. We haven't had that, knock wood, in the second semester, but I believe the number of students that have been quarantined is a larger amount. One, because the hybrid there was the ability to keep the 6 feet distancing. Two, it might have been when the student was positive, they weren't in the building, therefore they didn't expose anybody else. So this is difficult and frustrating. I can't imagine how frustrating it is for parents because I'm not in that situation. But it's frustrating for the teachers. It's frustrating for the administrators. But we're trying to keep 700 students here and provide the best education we can for 700 students. And it is unfortunate, but there is time to time when student A might need to stay home for 14 days, so 699 other students can be here and can be face-to-face to the best of our ability. And that's kind of a little bit of that trade-off too that everybody has been talking about. We want kids here, and this is one of the ways we can try to help keep as many students in the building as possible.
Well, there's a lot of negative opinion out there on your school, Mitch. For example, and you're not going to like to hear this, but a parent told me, I wish they'd work as hard trying to keep our kids in school as they do trying to keep our kids out of school. That's what we're hearing.
And I would argue we are working as hard as we can to keep as many students in the building as possible.
I'd like to make a motion that we.
Oh, you can't wait. Sorry. Oh. You're not in the action item yet. You're still in information discussion.
I made that mistake.
So I just got one other question that is somewhat related. It's all about keeping kids in school and more hours the better. Where do we stand on Wednesdays, Matt?
That's a next
Nope.
week's topic.
We have
Next
that-
week's already there. Oh, we can't talk about that, not even in discussion.
No, because it's on, now we're on protocol, 14 protocol.
Can we move forward to the action items then?
We can move forward to the action item.
Thank you.
So, action item number 1 is Mineral Point Schools quarantine protocol. Based on feedback from constituents, Mineral Point School District may choose to alter the current quarantine protocol.
So if we choose not to do anything with this action item, we maintain our protocol?
Correct.
Okay, then in that case, I don't have a motion because I would like to see us maintain what we're doing.
I actually want to weigh in on this. Can I do that since we're out of that and in this without making an action item?
Yeah, we're talking about it, I think, go ahead.
So I had that, Dr. Lindsay mentioned the conversation he and I have had this conversation with multiple people. I have a hard time not promoting the day 7 quarantine. And the reason being is, and I've had this conversation with multiple people, is in my thoughts, most junior high kids, especially high school kids that have active lives with their license, I mean, let's be honest with each other here. I got, feedback from this saying you can't just hypothetically say this, but I'm kind of saying it. How many of us, when we were in that age group, were going to stay home for 14 days of quarantine? That's just my thoughts. If we had a girlfriend, boyfriend, whatever, buddies out partying, but if we had something to fight for, say, hey, I can go back with a negative test result in 7 days after day 6, right? Then maybe I'd be more apt to stay to myself. And that's, I feel strongly about that still, even after multiple conversations that, that have bigger, smarter minds than mine. But then I go back to the thing is, okay, we have 3 doctors right here telling us, kind of guiding us through to say, this is what we should do. I've read up on it. Dr. Lindsay included after his and I conversation, he mentioned he was very in favor of it. And Doc, you're retired, you have a lot of time on your hands, so I know you can do a lot of reading. Me, not so much. So that's why I look to your guidance. And like you said, he was on board with this. But how can we sit here in this situation and say, yeah, we can go back, stay 6 feet away, like we said, we can't eat, 6 foot distance when we're eating, all of this stuff. And I have a hard time. That's why I wish we had those results of, hey, how many close contacts were positive. But I can't, in this scenario, say, look, you 3 doctors are crazy. But then next thing, if I've got something wrong with me, I'm going to go ask for their opinion. I'm going to go to the office and say, what's wrong with me? I know my leg's twisted in half in the bone show, but what's wrong with me? Am I going to go
Take
to
2 aspirin and call me in the morning.
Right? I mean, that's Marine Corps stuff, Doc. That's what they would do. So that's I'm really struggling here because, like I said, I'm a firm believer in saying, hey, if these kids had something to get back in school with a negative test result, they're going to stay away from people. 14 days, they're going to go running around. And I nothing is going to change my opinion on that. But the safest route forward, as of now, they're saying the 14-day. Plus, Dr. Fox, you kind of mentioned this. Would we have to get approval from the county to do this 7-day? Is that right?
Yeah, so the county had discussions with the school at the beginning of the school year, and then again, I think reaffirmed that last week with a meeting that all the schools were going to be following their recommendation of doing the full 14-day quarantine. So if you were going outside of that discussion with the county, discussion with this, what we know the state recommendation is, I think you would, I don't see how you would be able to move forward without having some sort of approval of your plan from the county, especially if you said, well, we're going to do 7 days, but we're going to do a test. I think they would have to talk you through when the test would be and whether it has to be a PCR test or an antigen test, which would absolutely have to be a PCR test. But again, I think they would have to weigh in on your plan and make sure that it's not putting members of the county at risk unduly. And consideration of, okay, so my kid was one of the contact traced for this last week. And, you know, it's not, is it fun? No, but she was in her room and I brought her snacks for 10 days. So she wasn't too unhappy. But you know, the idea that it's going to be hard or unpleasant for kids to complete a 14-day quarantine is certainly not a reason to get rid of a 14-day quarantine. It's and consideration of all those other kids that are in school. And if I knew that there was a lesser quarantine for kids after having been exposed, I would be probably pretty hesitant to send my kids to school, especially as numbers started to rise again, if we were to have another wave, you know, if that were, God forbid, to happen. So yeah, I think you've had approval of your plan from Iowa County Health Department. I think if you were to waver from that previously decided upon plan, you'd probably have to have them weigh in on it.
I got a question for Dr. Fox about the county. Dr. Fox, does the county still do contact tracing?
They do, but it's not as rigorous as what they were able to do when, you know, this was very first started, and calling people, you know, calling the close contacts and things like that. So they are doing very good household contact tracing. They rely on the schools to do the contact tracing for school age kids. And then in limited situations, they may, if it's a workplace outbreak or something like that, they will do more aggressive contact tracing, but they're not able to be quite as aggressive about it as they were way back when. And now with the vaccine being something that they're having some responsibility for as well, their staffing is just pretty challenging with being able to track all these people down.
If a staff member gets vaccinated, and they will, and they're deemed immune after so many weeks, will they have to quarantine if they're exposed?
Yeah, it's not clear where this will land. As of right now, vaccination does not affect quarantine or contact tracing, but I could see that at some point in the future, once we have some better efficacy studies, especially for some of these other variants, that could be a potential, that if somebody's been vaccinated and they get exposed, potentially they wouldn't have to quarantine and just self-monitor for symptoms. But CDC, nobody has made a recommendation to make that. We're supposed to be using the same precautions we were using before the vaccine was around. So masking and all the same protective things that we've been doing, we're supposed to continue at this point. But I'm hopeful that we can get rid of like maybe our eye protection in clinic. Maybe down the road we'd be able to do that. There's some potential that once somebody has been vaccinated, that they could be more likely to be an asymptomatic carrier of COVID. So they may not get sick themselves, but they may spread it to others. So the masks are still going to be very important. But again, I think it's likely at some point there'll be some change in contact tracing or change in quarantine for those who are vaccinated, but we're not there yet.
So I guess here's where I'm at on this. After hearing everything tonight, I'm not about to argue with any doctor's perspective or intelligence. But I do understand now that, and I understood this a while ago, that the common cold, the flu, all that stuff, bronchitis is gone. Everything's called COVID. And if it is the school nurse's job to assume that everything is COVID, then I don't know what more we have to say. I mean, I could ask how many cases of bronchitis have been in the school this year, kids have been out of it, I'll guarantee the number is going to be 0. Or the flu, it's going to be 0. It's further proof that everything is called COVID, so we just have to, I'm not going to say you guys, I don't want to put, but I guess I just have to accept that everything is called COVID now, we're going to have to move forward. I guess if ever, Larry, and maybe you don't feel that way, and that's your opinion, and I respect that.
Well, the meeting tonight, of course,
what I'm saying is
into two different topics, of course, now, both very important. But what we're discussing here is that if 3 members of the wrestling squad are exposed 2 days before a state final, there's nothing that this board will do. Can do, the way it sounds. Same goes for basketball, girls basketball, the whole gamut of winter sports.
Yes, if you got a tickle in your throat and you're within 6 feet of somebody, your career is over. That's,
I would just make the comment that they could all go virtual. The athletes, if they all went virtual, wouldn't that solve that problem?
And haven't some athletes made that decision?
yes, yes.
But there's always a risk of an opposing team having a.
Yep.
Yeah, right.
Correct me if I'm wrong, but I think that I was told that happened to an Iowa Grant wrestler.
What's that?
They wrestled,
They got it from a quad duel in Waterloo.
so an Iowa Grant wrestler wrestled a student that ended up being positive and was not able to wrestle last Saturday because of that situation.
Had they wrestled us, they probably would have been 6. That's a different subject.
And I'm not sitting here tonight thinking that we gotta get rid of the whole quarantine program. I would like to see a 7-day option with a test. And I'm of the belief that if we could get more kids to test, the school nurse should be doing backflips. That's what we want is kids to test, but we're discouraging them not to test.
So,
There's 2 different reasons to test. One is to identify positive cases, which we should do more of, because we're having untested cases slip into the school and cause outbreaks. So people who have symptoms should be tested immediately or be evaluated for alternative diagnoses. That is true. But what you're alluding to is being able to test out, right? So being able to test out of a quarantine, right? And that's where it gets a little stickier, because the reason why you're in quarantine is because you're waiting to see, it's called an incubation period, right? From the time that you contract the virus from a contact and develop symptoms, right? And the incubation period for COVID is 7 to 14 days, 14 being the max, presumed max. So basically, you could have a negative test on day 1, 3, 5, 7, 9, 10, 11, 12, and then test positive day 14 of your quarantine. That could theoretically happen. But as Dr. Fox showed, once you hit about day 7, the risk is less than 20% and probably less than 10% that you're going to test positive after day 7. So the risk of you testing positive later is low, but it's not 0, which is why the 14-day quarantine is safer than the 7-day.
It'll be interesting to see with the large number of students that are on quarantine right now, how many of them will test positive by day 14. Jane will have that number. She'll have that number.
No, because they don't have to test.
She'll only have it if people get tested. So I have seen some of the tests come through that have come through the testing system, and we've maybe seen 5 or 6 negatives, but that, we have how many, 50 some out from these exposures. So there are probably a good number of people who are not getting tested. And so those are still people who, if we don't wait those full 14 days and watch for symptoms and give that time to kind of wait after exposure, then we're running that risk.
Testing part that will come down with symptoms, and we'll all know that.
I would beg to, I just will push back that there are lots of people who are not reporting symptoms. And some of it is because it's a very mild symptom that they don't think twice about. They think I'm just congested. And so, they're not necessarily getting tested for those. And that is probably how we've had these last 2 cases in the school. Most likely, a lot of these people who get tested positive don't have other contacts. They don't know where they got it from. So that means they're being exposed unknowingly. So it's possible that it was in the school in the first 2 weeks of school, and these 2 individuals got exposed, and then now we see the close contact. So it's because people were maybe not getting tested for exposures or for symptoms in the time around Christmas and the first 2 weeks of the year that we're in this situation right now. So I would definitely recommend that we encourage people to get tested. I think, unfortunately, the people that did test positive and then, have this contact tracing, they end up getting vilified, and they, people blame them or are being angry with them for ruining the, school or making people get quarantined. And really, they did the right thing. They got tested when they had symptoms or when they had, a known exposure. And those are the people we should be saying, great, thank you for getting tested, because this is how we're going to control this within our school. So I would definitely encourage anybody who is a close contact to get tested, and there's many testing options, but it doesn't necessarily change how long you have to be isolating from other people. And the isolating from other people is really the key part of that quarantine that's unable to be done within the schools or sports.
I don't hear people getting vilified out there, Dr. Fox. The people that I talk to, they understand if the other students are guilty of that, then that's a school problem. I mean, they should be taught differently.
Okay, I will entertain a motion for action item number 1.
Is there any support to change it? If there's not, we're wasting our time with the motion.
I don't think there is at this point, right?
I just want to thank Nate for calling the meeting to clarify some of this. Thank all the doctors that presented and gave us their opinions, and anybody that weighed in with their opinion. It's been incredibly knowledgeable to sit here and listen, and a lot of things have been clarified. I think that was important. So I appreciate the meeting.
I do have a request too, Dr. Fox, on your next county meeting, if you could bring forward some of, the things that we talked about tonight, as far as, and I know you guys are at the meetings, right? Probably saying, hey, let's speed this up, or what can we do on these quarantines? Can we somehow test out of this eventually, soon, something, so we can see a light at the end of the tunnel? Because, that would answer some questions for us and community members as well. Because, that's and I understand that, hey, kids can't go back to sports. That's fine at this point. Let's get them back into school. Everybody's had their chance. So
the other thing I'll bring up, and I'll ask the county health department about this. I'm sure Jane will talk with them about this as well. But there was an article that came out today about doing testing within the school. If that's an option for things like antigen tests for people who have symptoms or things like that, as a quicker way to get to the answer. There were just a couple of articles that came out today from public health about that, and I will explore that a little bit more, and I'll certainly share that information with Jane and with Mitch as I learn a little bit more about whether that would change our situation at all in terms of when people can come back.
Thank you. All right, with no motion, that action item will die. Action item number 2, hosting sectional wrestling.
This situation, you put in to host a tournament about a year ahead of time. Mineral Point said we would host regional, sectional, something, and it's up to the WIA to decide. They contacted us and said, we would like you to host sectional wrestling. Several weeks ago, a lot of conversations that involved the head wrestling coach. And the belief at that time from all parties involved was the safest way is to protect the wrestlers is to not have fans. The WI was made aware of that and had every opportunity to move sectional wrestling if they chose. They still have that opportunity if somebody out there wants to do that. Like all of you, my email was blowing up with all sorts of parents reaching out. Very limited Middle Point fans reaching out, but still parents reaching out. Some interesting math that took place. I know in an email that I had sent out to the board saying, we would probably be in that neighborhood of 500 people in the stands. if you look at 112 athletes, you get 2 tickets, you're now talking about another 224 people on top of the 112. 88 coaches and managers, and the WIA is asking that each one of them get 2 tickets. So you add another 176 on top of the 88. You're looking at potentially 600 people being in the gym between competitors and fans. There'd be about 600 people in the gymnasium.
And the plan was originally without fans was the wrestlers and the coaches could socially distance in the bleachers.
So after all of the emails that we received, Mr. Austin, Ms. Stahl, myself, Coach Fiedler, Matt, we believe we want to do what's in the best interest of our students and our athletes. And we feel that that is doing what we have to do to keep the sectional wrestling tournament here in Mineral Park. And you know, again, Vicki has had contact with the WI as recently as today.
This morning. Yeah. But with the, we would use 2 tickets per family. So even if siblings are wrestling, they still just get 2 tickets, and it's going to go to immediate family where they would have to come in and sign in. We have to find another spot for the wrestlers. But, you know, when we put in to host these tournaments, we put in to host them for the kids. Parents might be upset with me, but I don't put it in to host because of parents. I don't put in to host because of fans. We put in to host because it's the best opportunity for our kids to play on their home field, their home mat, their home field, or, you know, home court. And I'm worried, okay, that, you know, we've got 22 schools represented. Everybody wants to compare this to regionals, but you can't compare it to regionals. There's 6 teams at regionals. And a lot of these schools don't have full rosters. We have 22 schools represented, okay? And they're going to be bringing people in. And that's fine. We can do fans. It's just we're going to have to make sure that people are going to have to follow protocols. 2 tickets, immediate family for competing wrestlers.
And reject. Nope, sorry.
Yes.
You can't talk during this discussion.
Yes. Yeah.
Okay, so here's what I want to, obviously I've thought a lot about this. I've been involved in this tournament since this school was built. There's 22 teams, that's 44 coaches, two coaches per team. 112 wrestlers, 224 parents. We don't need to have 4 mats down, because if you don't put 4 mats down, then that saves all the break time, so you don't have to worry about people walking around. Follow what I'm saying here? You don't have that hour-long break in between semis and finals. So you don't have to worry about people in huge groups in the cap. You're still going to have wrestling going on basically all day. All right? It's also going to limit you, take away from 3 table workers down at the end and a towel tapper. I don't know where this math of 500 people is coming from, because
Now you remember 3 coaches and 1 manager. So that's 4.
why do we need 3 coaches?
That's what the WIA wants.
Yeah, that's
Okay, so that's 66 then, if there's 22 teams.
right. And
So we're still
and
way
a
short.
non-coach manager.
The numbers aren't even close
Well,
to 500.
We can make it work.
I know we can make it work, and that's kind of my issue here, when we seen the email and it said we don't think we can make it work. And that's kind of the thing we've heard from so many administrators for so long, is when we talk about questions about this COVID, like, we don't think we can do this, we don't think we can do that. When I reached out to neighboring administrators in December and I asked the superintendents, everything they said was, we can do this, we're gonna make this work. We have ideas to make this work. But I'm so tired of hearing these things of, I don't think we can do this, I don't think we can do that.
I challenge the board.
In my line of work, we have to find
ways to do things.
Challenge
The
the board
original
to
number,
watch
Gary,
other
was
area school board
474.
meetings
That's the original
on the
number in
video.
that gym.
It's eye-opening.
Mayor, Jack, I have a suggestion.
Sorry,
Real quick, 10 seconds.
it's,
No, we don't.
we open up a can of worms. No, we're not gonna open it up to neighboring towns.
As a coach, I'd like to interject.
Sorry, sir, you're not our
470,
coach.
the original number with the WIA requirement for tickets was 474 people in this building, including workers. And that does not include giving the coaches tickets.
And we don't need we don't need a photographer for every team.
Tell me about it.
I don't
We
even.
already have nine.
Okay, so this is gonna shock everybody on this one, trust me. I expect a lot of hate mails and maybe some friendships. Like Vicky said, what is going on in that gym? Wrestling. How many times were your parents on the mat when you went to wrestle?
Oh, of course, coach.
Exactly. Who is our family? Who is our team? Who is our support group that I've heard over and over in these emails when we get off and on that mat? It's our team and it's our coach.
This guy right here.
So if we let 22 towns from across the state come into our gym, who's on top saying, look, person A in seat B12 had it. And all of a sudden 12 people get it. So who's to say that they're saying we can't contact trace, you're all shut down? That's my biggest fear. So then we do take this away from the wrestlers and we put it on, I'm sorry, but if this is going to sound, actually, I really don't care. Because if your high school senior needs you there to wrestle a match, I feel that there's bigger problems. Okay, I'm sorry, but I've been in that gym. I wrestled in it for 4 years. And I'm sorry, that's just my feelings. I've been thinking about this day in and day out. And I'm just a little bit sick of it because it's always me, but who's saying it? It's the parents. That's the biggest problem. And I understand it's meaningful. Trust me, I've been there. But at the end of the day, if we're trying to keep our kids on this mat, then why don't we, you said it, Gary, at the last meeting, as far as not wanting anybody in that gym. And that's my thoughts on it. We're letting other people from other towns we can't control.
I know that, but then.
And all of a sudden, who's going to call the shots? Who's going to say?
I hear what you're saying.
My fear is if we don't try to do something, we're going to lose it.
Absolutely, we're going to lose it, and you won't get it back.
So is it important to Mineral Point, the sectional tournament? Is it important? I don't know.
Yeah,
I don't have a dog in this fight.
It is important, and it's
Well, I would
important
think
that our kids are here. We've hosted regionals or sectionals for 20 years, at least.
25.
Yeah.
One of the potential host schools thrown out there was Westby. That's a 2-hour and 40-minute drive. Now, they did not.
Independence.
They did not say that they were interested in hosting it. But we don't want our kids to have to get on a bus on Saturday morning and ride 2 hours and 40 minutes for this. We feel that this is in the best interest for our students and our athletes, is to try to do something and keep the.
I understand that, but the lacrosse kids are coming here, so somebody's got to be on the bus.
You're right.
Right, yeah, and the vote was for no fans. And the injury thing that we're hearing is we had lacrosse Aquinas travel down here to play basketball, and there were no fans allowed. I mean.
But can I say a couple things?
Go ahead, Doc.
So, I got all the emails. I heard all the comments. I want to try to make it work for these parents. I've been to a wrestling tournament. I know how electric it is. How special of an event it is. I understand that. So my question is, can we make this work, right? But we're in a year where we had fall sports end prematurely. We barely had winter sports. We almost didn't have winter sports, is what I want to say. And then we didn't have spectators for a long time. I mean, it's a unique year and there's special considerations we gotta take into account. And, you know, we, the board, approved sporting events for the athletic director to implement under the WIA guidelines for winter sports, right? And which encourages, you know, all of the physical distancing and the mask wearing and all of that. And so there's going to be a max capacity that our space can hold with everyone being spaced out. And so we can either make it work to that capacity or we can't. So I'm in favor of pushing the limits of capacity as long as we stay within safety guidelines to make sure that we don't jeopardize any kind of chances for these athletes to advance in the playoffs, you know? But what I don't want is, I don't want us to make an exception to safety precautions for one situation, okay? I want to be consistent and I want to be fair. And so, you know, my question to Vicki, and I know you've been working on this for days, and I really appreciate that. And I'm inclined to support whatever you decide. Because I know you want to make it work. So, I mean, I just want to be reassured that, because there were a lot of suggestions from parents, you know, how can we help? Can we do split sessions? Can we do this or that? And, you know, I'm not involved with planning a wrestling tournament, so, you know, I'm not the best one to answer those kind of questions. In your opinion, have you explored all possible options to get as many people in there, especially parents of the players? And in your opinion, is the max number that's going to be allowed for this event the guidelines that we would apply to any event in that building during these times?
Well, with wrestling, it would be more spectators. With basketball, 22 on a team, so 2 rosters of 22, 4 tickets per roster spot. So that's for basketball. So you really don't even come close to what 220 figured out for a basketball game. Yeah, so we would definitely be over that allowing fans, but we have to make sure we take our wrestlers and put them somewhere else and not have them in the gym area.
So they wouldn't be able to support.
They're going to be out in the cafeteria because there's not going to be any concessions.
So Vicki, that would alter the mat side and section for that wrestler, correct? If the team couldn't be in the gym at that time? You said, or the person on the mat, right? If you take the team has to stay in the cafeteria, would not be in the gym.
Only the competing wrestlers will be able to be in the gym.
In the gym.
Yes, yes.
Just clarifying that.
Yes.
Okay.
So what I'm hearing is that instead of no spectators being allowed, you're now proposing that you've been able to create a flow for the tournament that would allow 2 tickets per household, per athlete household.
Yes.
Of every school.
Immediate family.
Okay.
Yep.
And you've been able to do that based on that example you just said, where you've got everyone stationed throughout the building and you're kind of
Yes.
bringing wrestlers in individually.
Yes. But,
Okay.
you know, once we have spectators, then, you know, you also need to add workers. So we're going to have somebody at the door taking, you know, admission. There'll be no money exchange, but so, you know, I know the wrestling club has volunteered to help out, and, you know, they know how to work a wrestling tournament because those are my table workers basically. So. And I believe too, Jerry, correct me if I'm wrong, it's one and done too. So there are probably some wrestlers and parents that will leave once they get beat.
The thing with split sessions, I'm not gonna say it won't work, but I'll tell you why I don't think it will work is because you're gonna have that 50-minute break. You know, where by rule, they have to have 50 minutes.
Yeah.
And if you do that split session, some of them, if they go 4 matches through the day and they gotta wait for that 3rd place wrestle back, you could be pushing, you know, that second session to start possibly 2, 3 o'clock in the afternoon. And you don't want parents getting out here at 8 o'clock at night.
No.
So, would it work? Yeah, but
We have a UV light disinfectant that, a weight class is on a mat. The suggestion is you put a weight class on a mat, and as soon as that weight class is done, disinfect the mat. Well, with the UV light, we can speed that disinfectant process up much faster than the spray, mop it down, and then you have to wait for the mat to dry. So we feel we can speed that process up too and try to keep everybody as safe and healthy.
I don't even know how many sectionals there are in the state.
4.
There are 4. So are the other 3 schools allowing fans?
Dodgeland is not. Dodgeland is not.
The other 2?
The other 2 are.
Okay.
I'm not sure if they're 1 or 2 tickets. There were some schools that ran the regionals that did 2 tickets.
And are they about the same size?
What?
What?
Yeah, there's about like 112 competitors in each section. Yeah.
Do you need board approval then, Vicki, to make this work?
No.
I'd like to remind the board that at our last board meeting, we basically said we're putting our faith in Vicki or as our athletic director to work within the guidelines that the WIAA gives and work closely with Mitch and whoever else to make the right decision. And I don't know that that's changed.
Well, the one thing, and I can go back to August, is I was asked, because that was the meeting we were talking about fall sports, and I was asked if I can guarantee, if myself and coaches can guarantee the safety of our athletes. And so I hope all of my wrestling coaches are listening tonight, because they're also going to be responsible for that. Because we are going from 230 people to almost doubling that in our building.
I have another thing on this too, is just so everybody is aware that these matches will be live streamed on Track Wrestling for everybody to watch. That is another point I wanted to bring forward.
if the track doesn't crash like it did Saturday.
Okay, well,
I have a little backup.
Yeah,
that's the case. I
you got a
got
tech.
nobody backup, but
Nobody can do anything about that.
Is there any thought that this could be split over a couple days?
they can't, Doc. There's limits on when they can wrestle next. Right, Gary?
Yep.
Is that based on their weigh-in time?
No, they can't have X amount of days of consecutive things.
Because of this year, essentially.
So Vicki, what would the timeline be for you announcing what the official plan is if we move forward with limited spectators?
Basically, I just send it all the athletic directors, the competing schools, an email, and they'll get it out to their parents. And we'll do a sign in here when they get here. They'll have to sign by their athlete's name. And we have plenty of media that are going to be here, so I can also send an email to them and they'll get it out. WIA will put it on their website.
This being an action, sorry, go ahead, Amy.
That many spots available? Are we gonna have like 2 sets of parents from one community sitting together on our X's, or are we gonna be tighter than 6 people?
Well, I mean, obviously, if you're immediate family, I'm hoping you'll sit together. And Corey made a good point. You know, there's pictures. I mean,
Yeah, I just didn't know-
pictures from regionals
I
where
didn't know if there was 112
see the
spots.
team's fans and they're all in a cluster together. You know,
Yeah,
I mean,
anybody who emailed us and said that social
regionals
distancing
is,
policies were followed in Lancaster
yeah,
wasn't paying attention.
yeah. Sectionals
Miracle
are
Point section
very,
is
very
fantastic.
hectic. I do have 2 parents from Lacrosse Aquinas though, that volunteered to be the mask police. So I'm gonna send them an email tomorrow and say I'm gonna take them up on their offer.
We'll probably do it too.
This being an action item, as I was saying, I feel we put this on the agenda to make a motion on this and not to throw it at Vicky. That's my personal thoughts on this. And again, I'm sticking to my guns on this as far as my position, especially knowing that the rest of your team will not be in there cheering you on, because they can't be if we have other fans in that gym. And I'm sorry, no offense against mom and dad, but you weren't in the wrestling room pouring out blood, sweat, and tears with that teammate. So again, I have been there. So like I said earlier, bring on the hate phone calls. I don't care. That's my position on it. That's my thoughts on it. I guess I will entertain a motion if we want to make a motion on this.
Well, I support a limited number of fans per family, per wrestler, whatever. And nominate the parents. The parents were the ones writing the checks all them years, and they write checks to their respective school districts in the form of property taxes, just like our parents do here to keep this show going. And it's not really fair to say that the parents didn't have a part in.
I didn't say that they didn't have part of it, Larry. I said that they weren't in the wrestling room. You know, so am I. That's exactly what I'm saying.
I just wrote my check.
And that's fine. And you know, and I didn't mean it anything like that. That's why I said no. You know, no offense to the parents. Again, I've been in this position to somewhat, not obviously this hectic year, but I know who I wanted Matt side cheering me on.
And it's going to take extra work by a lot of people, and it'd be nice if there were some volunteers to step up locally and
I'm sure, and
participating schools.
and I don't know if this is the way it goes. I don't doubt that will happen. I mean,
Everybody's volunteering.
Everybody.
I understand.
And exactly, and I don't doubt that one bit, that it will be as safe as it can possibly be. It's just the fact that who's calling the shots on a close contact when they say, look, we'd had too many people, or somebody had God forbid somebody got mad and said, oh, well, I came down with it. Boom, now your wrestlers up because you beat their kid in the finals or the semis. I'm just my mind. That's my thoughts.
So I think, and Curtis, Coach Beaver and I talked about this too, just how awful both of us would feel if something did happen. But I guess those are the chances that we're gonna have to take.
There's risk, Vicki, and there's probably a better risk of a family getting into a traffic accident on the way to Mineral Point. So there's risk every day.
So I make a motion that we empower Vicky as our athletic director to move forward with limited attendance in a manner that minimizes risk.
I will second that.
Okay.
And then I will, a couple of statements. My hesitancy to this was absolutely about the kids and the 8 families we represent. And while I appreciated the 33 other emails that we got, somebody else represents them. And so it was about the 8 kids we have participating in their families. And saw Coach Fiedler on my way in, and he had talked to the kids, and the comment that was made was, the slap on the mat's a little bit sweeter when there's a roar of a crowd behind it. And if that's where the kids are at, and they've put the time in, I'm going to support this. But I am disappointed, and it's an overall disappointment. And again, most of the emails were from our parents, but I had hoped one of the things our kids would get from this entire COVID experience was to eliminate some of that sense of entitlement and taking things for granted. And in August, in September. Did you expect a sectional in September? Yeah, nobody knew there was going to be a sectional.
Baseball team didn't get anything.
This is the first postseason in a year for some of these athletes. And all of a sudden, we're right back to this is where we're entitled to, and we are depriving people, and I'm just disappointed that there's not more of an appreciation for the fact that they get to wrestle, the fact that this event has happened. And I was hoping that would be one of the positive byproducts from this COVID experience. And the tenor of a lot of those emails today was still that entitlement of what people deserve and what they've earned. And I think we just have to continue to remind everybody that we have lost things. And this is, it's a great opportunity that they get to do this, however they get to do it. So I'm going to support it because our kids would like the Mineral Point crowd behind them, but I am a little disappointed that we are right back to expecting things instead of appreciating.
Andy, I did get some emails from some athletic directors and from other schools, and just that they knew what was going on. And they apologized and said, hey, we're just happy that you're hosting and giving the kids an opportunity to wrestle. They didn't really care whether there were fans or not. So.
Just so, hey,
Yep.
you and I, we can disagree on this all day and we're still gonna be friends and respect each other. But hey, and the kids, they want to hear that roar of the crowd.
I get it.
And, yep, and you know as well, there's nothing sweeter
No,
than here, and it's not gonna happen.
And the parents sending out the emails, they were advocating for their kids. What do you expect them to do? I expect that for
I
any
would
kid.
say there
Several
were
of them
different
were
tones.
Yeah, some were.
Yeah.
There were some really nice,
Some were
well-written
kids.
professional ones, and there were some that were not so nice.
Well, when we get a hot topic locally, it's the same thing.
You're right, it is. You're absolutely correct.
All right, we've got a motion and a second. Any more discussion?
You want anything else in that motion, Vicki?
I don't know that I like the word empower, but,
Well, what would you prefer? I would gladly amend it.
No, that's fine, because I'm the tournament manager, so.
I would add to the best of your ability.
Yeah.
I'm cognizant of the community perception that this event will be nearly double the amount of people inside our building from 22, 21 other communities than many other events so far in the school year. And I'm cognizant of how that looks from a public perception. And I want to make sure that I can look people in the eye and say, hey, we are able to make this event work with that many people and still rotate people in and out and keep people spaced and still minimize risk, inconsistent with WIA guidelines. Now, I hate to put you on the spot right here, but it's just to help me understand so that I know what I'm voting on here. When we talked, what I remember you saying was, I've looked at the situation, and if we're to space people out, I can't see us having any fans. And
that was when.
That made sense to me. So
Great.
Help me understand.
Well, with the wrestlers in the gym.
Okay.
So if we move the wrestlers out of the gym, we will be able to distance the fans. Because what we'll be able to do is try to do 112 on each side and have signs where those schools will sit.
Okay.
So instead of having potentially 300 plus people in the gym, you're only going to have 200 plus people in the gym at any one time?
Taking the wrestlers and coaches out, basically.
Okay. Okay.
And where will the 22 schools sit? Will you spread them out in other open areas of the school?
Are you talking about the wrestlers?
Yes, the wrestlers.
Well, wrestlers will probably use the cafeteria.
Okay.
Our wrestlers will probably use a different room, but the cafeteria we'll use for the rest, the other wrestlers.
So some schools have one wrestler that's qualified,
right.
others have up to 10. So I mean, there'll be different clusters, but
In that space.
yeah.
I mean, I'm nervous about it.
I hear you.
Yeah, so.
I hear you. I just want to hear from you, okay, I didn't think fans could work. Okay, now I found a way to make it work for a limited amount of
Yeah.
fans. And I just want to understand how you've been able to make that work. And still feel good about it.
Well,
But so that helps. Thank you.
The other positions, we're not following all of the WI requests that say if all the coaches and managers that show up would get to, we are telling people, no, because that eliminates another 100+ people being here in attendance.
Yes.
So, I mean, we're trying to get the parents for those athletes here.
And that's it.
And you're retracting the ticket request for the coaches and managers.
Correct.
Okay.
And we're gonna deep clean Sunday before our kids get back
Yes.
in the cafeteria and the gym.
Yep. Well, we'll be using those UV lights. You didn't get a tan, but we use so much.
Okay, motion and a second on the table. We will call the question, please, Angie.
Heisner,
Yes.
Lindsay,
Yes.
Sullivan,
Yes.
Stefas,
Yes.
Bush,
Yes.
Dunn,
Yes.
Chambers.
No. Do I have to take this off, guys?
No, but if you could give them your phone call or your phone number now.
They got it.
You didn't cave to pressure, Nate.
No, and my reason is, again, like I stated, my teammates.
Well, that's fine.
That's my biggest thing.
This is something.
Can I still call you Nate?
What's that, Doc?
Can I still call you though, Nate?
Okay.
I've had a couple of parents reach out to me, Vicki, and it's about the gym. Letting youth sports groups start using the gym for practice, and even some of our clubs that include a lot of Mineral Point kids. When will that happen?
I don't know. Because one of the things that we've tried to do is not to have the elementary or outside club kids come in and practice.
I mean, you're aware that they're traveling to area schools to practice.
Probably, yes.
They're still practicing, and just put it, I'm just gonna put it on the board's radar, because I think, you know,
Put
I have
that
one too.
as
So
an
thank
action item for next Monday.
Yeah, we'll jump on that.
Yeah, put it on, please, next.
Thank you, Larry, for reminding me of that too.
We
All
can-
right.
We can talk about it.
Okay, I will entertain a motion to go into closed session.
I will make that motion.
Maybe like a second?
For what reason?
I'll second it.
Convene in closed session, considering employment, promotion, compensation, performance, evaluation, data of any public employee or which government body has jurisdiction or exercise responsibility.
Okay.
Sound good? Okay,
There's, you have no more specific than that?
that is all I'm gonna say.
did it stem from the last meeting?
Yes.
Or no, brought up?
Yes,
Is that
Follow from the last meeting
yes,
that we
Okay.
discussed in closed session.
we can word it that way, yes.
Do we have a second on that?
I'll second now.
Now I have something to vote on. Thank you.
A motion and a second, a roll call, please, Angie.
Sullivan,
Yes.
Stefas,
Yes.
Bush,
Yes.
Dunn,
Yes.
Heisner,
Yes.
Lindsay,
Yes.
Chambers.
Yes. So you're gonna be perfect.
Dr. Lindsay, I'll send you an invite.
Keep in mind.
That's the thing, you do this.
Okay, thanks.
Thank you three for your input.
Thanks for the time. Thanks, Cash.
Thanks, Corey.